Everyone gets pimples at some point in their lives. There are many different types of acne pimples. All pimples result from clogged pores, but only inflammatory pimples emit the most noticeable pus. Pus is a result of oil, bacteria, and other materials that get clogged deep within your pores and your body's natural defense response to these substances. Read on to learn more about pimple pus, what causes it, and how you can treat and prevent inflammatory acne pimples. What is pus made of? Pimple pus is made from sebum, oil, that gets trapped in your pores, along with a combination of dead skin cells, debris, such as makeup, and bacteria. When you have inflammatory acne lesions, such as pustules, papules, nodules, and cysts, your immune system activates in this area, resulting in noticeable pus. Acne pustules have a whitish fluid inside them. As the inflammation improves, the pustules will also improve and go down. What causes pimples with pus to appear? Pimples with pus appear from both inflammation and as an immune response to the clogged substances in your pores. Pus only occurs in inflammatory acne. Non-inflammatory acne, like blackheads and whiteheads, also involve clogged pores, but the resulting comedones are filled with hardened oil and dead skin cells, not pus. However, it's possible to irritate non-inflammatory acne from picking at it so that it becomes inflamed and filled with pus. Pus-filled inflammatory acne can include the following: cysts. These large, painful masses develop the deepest underneath your pores, where the pus doesn't rise to the surface. Nodules. Like cysts, these pus-filled pimples occur beneath the surface of the skin. Papules. These small, red pimples develop at the surface of your skin. These pus-filled acne lesions are similar in appearance to papules, but they're much larger. What's the best way to treat pus-filled pimples? When treated, pus-filled pimples will start to dissipate on their own. You may notice the pus disappears first, then the redness and overall acne lesions lessen. Above all else, you must resist the urge to pop or squeeze out the pus. Picking at acne can cause the inflammation to worsen. Don't pop or squeeze pus-filled pimples. You can cause the bacteria to spread and the inflammation to worsen. Over-the-counter treatments. You can try using the following over-the-counter, OTC, treatments for pus-filled pimples. Benzoyl peroxide. Benzoyl peroxide helps kill bacteria in your pores that can lead to pimples with pus. It's available as a topical gel, for spot treatment, and as a face and body wash. Benzoyl peroxide can inactivate certain prescription retinoids if used at the same time, and it may be irritating to the skin. If you get irritated with this medication, you can decrease the frequency of its use, including how long you leave it on the skin before washing off. Note: be careful when using benzoyl peroxide. It can bleach fabrics, including clothing and towels. Salicylic acid. You can find salicylic acid in spot treatments, face washes, and toners. It works by removing dead skin cells at the skin's surface so they don't clog pores. It can be irritating to the skin. Retinoids. Retinoids are typically the first-line medication used for all forms of acne, especially acne on the face. In recent years, adapalene 0.1% gel, Differin, has become available OTC. You must use it regularly for at least 3 months before you see effects. Apply a pea-sized amount every other night in the beginning. Spread it to the areas where you're prone to get acne. This will help prevent new acne from forming. It's not meant to spot treat current acne. When using retinoids, you may become more sensitive to the sun and experience some dryness. A daily moisturizer with an SPF can help. Prescription medications. Some people may be able to treat their acne with OTC medications, such as the topical retinoid differin or benzoyl peroxide. However, other people may benefit from a consult with their primary care doctor or dermatologist to determine what prescription medications would be best for them. Prescription medications for acne can be both oral and topical. Your specific prescriptions will depend on your type of acne, including the location and severity of your acne. Prescription medications include antibiotics. The bacterium P. acnes is known to be involved in forming pus-filled pimples. Your dermatologist may prescribe a round of antibiotics if they suspect this to be the case. Your dermatologist may prescribe topical antibiotics instead. You can use these for much longer. Antibiotics in dermatology are widely used for their anti-inflammatory effects, in addition to their ability to suppress P. acne's growth. Dermatologists believe that if you're using oral or topical antibiotics, you should be using benzoyl peroxide alongside it to prevent P. acne's resistance to the antibiotic. Oral antibiotics are also not meant to be used long-term. Rather, they're generally used as a temporary measure to allow time for topical medications to start working. Birth control. Some women can benefit from taking oral contraceptives, especially if acne breakouts are more common around menstruation. There are several Food and Drug Administration approved combination oral contraceptives that are used specifically for acne. Some studies. Trusted source suggest birth control is just as effective as antibiotics in treating acne. Discuss this line of treatment with your primary care doctor or OB/GYN. Isotretinoin. Like retinoids, this oral medication is a vitamin A derivative. Isotretinoin is the closest thing to a cure that dermatologists have for acne. Doctors often use isotretinoin in patients with acne that doesn't respond to traditional acne medications. Acne that produces scarring. Severe nodular cystic acne. Spironolactone. Commonly used as a blood pressure and heart failure medication, this anti-androgen medication is also used in dermatology as an off-label acne treatment. It's only used in women. Home remedies. Some research suggests that certain home remedies can help acne, but more studies are needed before these are considered viable treatment options. If you're curious about alternative treatments, talk to a dermatologist about the following home remedies before starting them: fish oil, lavender oil, probiotics, DO tree oil, zinc supplements. How can I prevent pimples from occurring? While certain risk factors, such as genes and hormones, can play a role in pimple formation, there are steps you can take to minimize their occurrence. Consider the following do's and don'ts. Do wash your face once a day, and only use oil-free, non-comedogenic products on your face. Follow each cleansing session with an oil-free, non-comedogenic moisturizer with SPF in it. If you're on a topical antibiotic such as clindamycin, then apply this first before using your moisturizer. Wear sunscreen daily, especially when using retinoids. Choose oil-free, non-comedogenic makeup. Apply spot treatment as necessary. Don't scrub your skin when washing it. Skip out on moisturizer. Doing so can dry out your face and cause your oil glands to produce even more sebum. Touch your face. Rubbing your skin can clog pores. Attempt to dry out pimples in the sun. This can overdry your skin and also increase your risk for sunburn and skin cancer. Use toothpaste as a spot treatment. Pop your pimples or pick at your skin. Overuse spot treatment or toner. These can dry out your skin. Use alcohol-based products. When should I see a doctor? It can take a new skincare product several weeks to take full effect. If you don't see any improvements in pus-filled pimples after a couple of months, you may consider seeing a dermatologist for help. They may recommend a prescription strength formula. Also consider seeing a medical professional if you have widespread cystic acne. You might need an antibiotic to help get rid of this type of breakout. The takeaway: pimple pus is a natural substance seen in acne breakouts, but you don't have to put up with it forever. By practicing good skincare habits combined with OTC acne medication as needed, you can help reduce pimples and pus overall. If OTC treatments fail to work, see a dermatologist. They can recommend treatments and prescribe oral and topical medications.